So our next speakers are Dr. Cristina Vasilica, who's a postdoctoral research fellow in social media, and Paula Ormandy, who's a professor in long-term conditions, and they've been carrying out an innovative joint venture between the Hope Kidney Patient Association and the University of Salford. And this project won a prize sponsored by Innovation Agency, run by the Northwest Adult Learners Awards this year. So, over to you. Thank you.
Good morning, everyone. Thank you, Caroline, for inviting me. It's a really privilege to be here. Today I'll be presenting about the impact of the Greater Manchester Kidney Information Network on people's lives. Just to follow on Kate's legacy, my name is Cristina Vasilica. I'm a researcher in digital health at the University of Salford. My background is in business IT, and as you can see, I'm coming from the land of Dracula, but nothing to worry, I passed the garlic test. Since 2009, I worked with Professor Ormandy, who's here with us. Hello, Paula. To develop and deploy digital technologies in health. And some of the projects we've won include developing a digital strategy for Brook Advisory to engage boys and young men to look after their sexual health, or managing a social media campaign to increase awareness of cervical screening amongst women in the Northwest. And our latest project, which is GMKIN. Before I'll go into the technicalities of GMKIN, I will play a video which is a poem from a patient who summed what GMKIN meant for her.
The seed. From an idea, a simple seed, now GMKIN has a massive Twitter feed to join together in unity and help support our community. If it seems like life has let you down, when it feels like no one's around, a new diagnosis or long-standing query, to have a laugh or share a story. Illness doesn't discriminate, it pulls you in like fish to bait. Like a thief in the night, it can suddenly appear and take away all we hold dear. For a friendly chat, a listening ear, a place to go to express our fears, to read and learn about CKD, or simply get a recipe. So we thank GMKIN for all you do, and here's to friendships old and new. Go spread the word, share our views. Thank you for listening.
Lean on me.
GMKIN consists of a Facebook group, which is a closed group. Currently we have over 333 members, and the Facebook actually has proved the central route into other resources like the blog. Facebook is the most preferred platform amongst patients because it's easy to use. It is available on most devices, and because of its dual purpose, which is keeping in touch with friends and families while it's keeping an eye on health issues. We also have the GMKIN platform, which enables patients to register blogs and register story and comment, sharing their own experiences. And up to date, we have over 205 blogs from patients, which altogether generated over 400 comments, and patients posted over 500 news stories. The platform generated overall over 40,000 page views, and it was visited by almost 15,000 visitors. Patients prefer to write blogs because writing a blog is therapeutic, and they like reading the blogs because that way they find information on how to live with the condition and how others are dealing with CKD. GMKIN has also a Twitter feed. And although Twitter is the least preferred platform amongst patients, it is used mostly by those with proficient digital skills, and they use it to connect with healthcare practitioners because they know everyone is on Twitter. So what makes GMKIN different? GMKIN is different because it recognizes patient talent. Since the inception, we worked with patients to involve them and to empower them to run GMKIN and we provided training on how to manage the network, and currently GMKIN is entirely run by patients. GMKIN is local people, local voices. So everyone around Greater Manchester who relates to the same services and to the same hospitals, they come and share their own experiences. And because of the fact that it's local, and once we developed GMKIN, we applied the principles of social capital, which is building trust and building relationships amongst people. Some of the conversations have now moved from online to offline. So patients meet offline, they are more engaged in the local community, and they attend events in the hospitals. And we also have a national treasure of patient stories. With GMKIN, I've also did the longitudinal study, for which I followed people for over 6 months to see how they engage with GMKIN and the impact that GMKIN has on their life. And we applied theory in practice. So a study by Professor Ormandy identified that patients want to talk with each other, and they lack, their information needs is not satisfied. So we applied theory, and we looked at how we can actually use social media to engage patients better. And as a result, the results of the study identified that for patients to engage, we have to provide a medium that is local, it's influenced by friendship, by trust, and also because of the information shared. And as a result of engaging with a social media platform, they will actually access information which satisfy their information need. And in terms of their information, they recognize symptoms, they have hope for better treatment, and then they have better understanding of the condition. Which access to information then influences health outcomes. So patients involved in the study reported an increase in self-efficacy and better illness management, and also increase in self-esteem. And we also identified social outcomes. So patients engaged with GMKIN reported that they are more involved in social activities, they are more activated, and some even indicated that they are keen to take on employment. And here are some case studies. So we have a young female. She's 20. It's a young patient. She's 27. She's on pre-dialysis. She's in employment, proficient with IT, and she likes to cycle and be involved in outdoor activities. And the reason she joined GMKIN is because she wanted to show other people that you can still you can have an illness but still be involved in other things. And she's using the platform occasionally, only when she feels down, because she finds it's really refreshing to read other people's stories, and it helps her deal with her own issues. And she actually shared the story that she was told not to take anti-inflammatories because they are not good for her health. But she thought, if I'll just take some, it will not damage my kidneys. But then, reading a blog from another patient, she realized how bad it is to take painkillers. And she then thought it's better not to use them. Another case study is from John. He's in his 40s, on dialysis, diabetic. He reported he's self-reported with depression. He is employed and initially struggled with the digital skills, but we provided him with training, and he received an iPad to access GMKIN and other social media platforms. And as a result, and he actually calls the iPad his lifeline now. As a result of that, he felt that he's not depressed anymore, because he thinks that depression you get when you are alone and nothing you can do. But now, through GMKIN, I got involved in other things. And he also stated that before GMKIN, I did not even use my phone. I upgraded my phone as well, and I think I upgraded my life. We also have a case from Don, and he's male, he's on dialysis, and he's been on dialysis for over 3 years. He's unemployed, and he actually joined the network thinking that it will help him develop further his digital skills. And as a result of being involved and receiving the training, and he also received an iPad to access the resources, he applied for 2 jobs. And as he said, I didn't get the jobs, but I felt really good. We also received feedback from family members, and this is a piece of feedback we've received from Pete. And he actually felt that GMKIN provided with the support that his mom sought for years in order to manage with her eating disorders. So Pete said GMKIN was the first time she had been given a lifeline that let her deal with her difficulties. Not just her life with CKD, but also her eating disorders and depression. On her own terms, GMKIN made the last few years of her life indefinitely less painful, and I believe they contributed to her eating regular meals again, something she hadn't done for at least a decade. GMKIN is the only thing I ever saw that had a lasting positive effect on her. And we also have views from clinicians. And this is a quote from Professor Phil Carla, who is a consultant nephrologist at Sulphur Oil. And he thinks that GMKIN is a fantastic advance which enables patients to talk with each other, but also enable health professionals to communicate better with patients and to inform patients about existing research and involve them in research. And I have a few more videos from patients. So the quality is not great, but the videos have been recorded by themselves.
GMKIN to me is an organisation run with passion and care. We all realise that we're not alone in this fight, so we try and support each other the best we can. We tend to get to know each other more via Facebook, and then we meet up at the conferences, etc. It makes you realise what other people go through. It's not just yourself. Also, the website, you get a deep, reading the blogs, you get a deeper understanding of people's problems. And I really think we would be lost without it. Thank you.
GMKIN is a peer-to-peer support network for kidney patients. It's based around a website and social media services such as Facebook and Twitter. It's been around for over 3 years now and has developed into quite a substantial resource for patients and carers. It's had a profound effect on me personally. When I joined the group, I was suffering from a bad case of depression and struggling generally to engage with the world. GMKIN gave me a voice. It gave me an opportunity to help other patients. As a direct result of that, I got involved in lots of other kidney-related projects, research projects, patient support groups. Eventually, that has led to me regaining paid employment for the first time in over 10 years. And that in no small part is down to the increased self-confidence I got out of working with GMKIN, doing the work I did on there, and also the sense that I was actually helping people, and GMKIN was a friendly environment. It was easy to help other people, and it was founded on trust. The things I liked about GMKIN, in essence, is it's based around 2 local hospitals. So patients knew the same hospitals, knew the same doctors, knew the same processes. That helped enormously. So now, as I say, I'm working full-time. I now work as a patient advocate and support officer for the British Kidney Patient Association, and my work is largely an extension of the things that I and others were doing on the GMKIN group.
In terms of some of the GMKIN success, we've contributed to, so the research behind GMKIN contributed to national guidance on how to use social media for patient involvement and people's involvement in general. And we won an innovation award, and we've also been nominated, we've been nominated three times as the best posters at different conferences. Thank you. If you have any questions.
Have we got any questions for Cristina? There is a chance to find out exactly, how you go about setting up a moderated patient community like GMKIN this afternoon's workshops. But if you have any questions, put your hand up now, otherwise we'll move on.
What was the cost? The overall cost of setting it up in terms of allocated staff time or equipment like the iPads and training up people to use them?
We received a grant of 16,000 K, and that supported us to engage patients and buy the iPad. So we provided 10 patients with an iPad. I've set up and I've moderated the network as part of my PhD study for almost 2 years, but throughout this time I've actually supported patients and empowered them to run the network. And now the network is entirely run by patients supported by an advisory group.